Hi, guys. Hi, Jana. Welcome. Thank you for joining us.
Hi, Anne. Thank you for another invitation.
I always love chatting to Jana because our conversations are always very interesting. And I'm really excited about today's topic. We're talking about the common fitness mistakes that rehab professionals see daily. So I don't know, even know where that conversation is going to take us. It's going to be so cool. Those of you that are joining us live, please let us know where you're from. It's super to have you with us. We're really here to have a conversation with you. So join us, ask questions, share experiences, just join the conversation. Jana, will you please introduce yourself? Tell us a little bit about who you are, your journey, and why you're interested in today's topic.
All right. So, hi, everybody. My name is Jana Gams, and I'm a veterinarian. I'm also a certified canine rehabilitation practitioner. I'm the founder of Dogs for Motion, a canine rehabilitation and sports medicine center located in Slovenia, that's Central Europe, where I work daily together with my wonderful team. We work with canine clients and their owners, from working line athletes to companion animals that are recovering from injury or surgery, and of course, managing chronic conditions. I'm also the founder of Dogs for Motion Academy. That's a learning platform where we share educational content with dog owners all around the world. And I am an agility and SCI obedience with now over 20 years of experience in dog sports training. And I'm the owner of 3 border collies, aged now 14, 11, and 3 years. Well, if you follow me or Dogs for Motion on social media, you might have also seen me with Tilly the Westie. She's actually cared for by my parents, but she's an amazing little dog, and I love to steal her for walks and also some training sessions. Now, my passion for canine rehabilitation and conditioning exercises comes from my love of teaching dogs. I have been training all sorts of different behaviors, different tricks also, ever since I got my first dog at the age of 14. So dog training carries many of my personal emotions and memories. For example, I was even training my dog Brie for her role in TV movies and commercials. And over time, I found that working in the rehabilitation veterinary field really fulfills me the most. I really believe that when done properly, conditioning exercises can significantly improve the long-term physical well-beings of our dogs. And I also love sharing my knowledge and teaching others. And that's also what kept me connected also with the VAHL Veterinary Academy of Higher Learning Organization, even after completing my CCRP certification. So in addition to delivering a few webinars, I have also been an instructor for the CCRP course and the CCFT course. And I'm sure there are some more opportunities to come in the future.
I love that. And yes, I mean, your passion for kind of teaching and sharing your knowledge definitely shines through the platform that you've created and the lectures you've presented for us. So thank you for sharing that, Jana. Guys, if you've just hopped online with us, welcome. It's so good to have you. If you're joining us on Facebook, I had a little technical glitch there in the beginning, but it looks like we're live and everything looks good now. So let us know where you're from. Say hi. Please join the conversation. Feel free to ask questions or share your experiences throughout. Today, we're talking about the common fitness mistakes that rehab professionals see daily with Jana Gams from Dogs for Motion. Okay, so Jana, from your experience, what are some of the most common fitness or exercise mistakes that you see in clinical practice?
Thinking about clinical practice, I would say that one of the biggest mistakes that we can make as professionals is not guiding owners with clarity and confidence. Communication can be really our biggest asset, but also our biggest enemy if we don't communicate clearly enough. Because most of us can probably demonstrate an exercise with the dog in front of us just fine. We know what we're doing and what we want to achieve. But the thing is, unless we have those clients come in 3, 4, even 5 times a week, we need to prescribe these exercises as part of the dog's daily home care. And when we give out vague instructions about how, where, and how much to perform the exercise, we leave clients with a lot of uncertainty. So instead of saying, do this exercise a few times a week for maybe a few minutes while showing it once, we should be way more specific. So, for example, do this exercise where you cue your dog to sit and invite them to stand forward towards you 5 times a week for 7 repetitions in a row. Then give your dog a minute of rest and repeat the exercise. Perform it on a non-slip surface, such as a carpet, yoga mat, or on the grass. So show them the exercise, explain what it targets, point out important watch points, and then have the owner perform it with the dog in front of you to make sure that they can do it well. You can also record a video if needed. So provide written instructions, demo videos, whatever tools that can help make the instructions stick. So don't leave them wondering what, how often, how much. And the same goes for like other stuff like daily walks, not just rehab exercises. So we really need to be precise in our wording and clear in our goals. And we must be confident in what we say because we know the job. So for example, saying like, take your dog on a short walk prior to exercises is for sure not as clear as take your dog for a 3 to 5 minute walk prior to exercises to gently warm them up and allow them to relieve themselves. So really give them measurable instructions, duration, repetitions, frequency, also details on the setup that is needed at home. Because believe me, a confused client will often lose motivation or choose not to follow your instructions at all. Sometimes doing nothing is the least harmful option. But imagine this. I once had a dog that came into my practice a week after TPLO surgery. The owners were told by their surgeon that they could start short daily walks. I asked them, okay, how far did you go? And they answered 5 kilometers. Because for them, 5 kilometers were short. Before the injury, they were doing 10 to 15 kilometers a day. You know, this was a husky. But for a post-op dog, this was absolutely not okay. So remember your wording, remember your clarity, and know that even when we do everything in our power to provide clear guidance, some clients will still only pick up parts of it. And that's why I always check in during follow-ups. I ask them to show me what they have been doing. And yeah, sometimes we simply need to repeat what we did the session before because they didn't get it right yet. So what's the point then in overwhelming them with more homework? So that I think was one of the biggest mistakes. I had maybe another one that could be like not recognizing when an exercise setup is helping and when it could actually be doing harm. Because, for example, especially when rehabbing tendinopathies, we know that it's really important to load tissues progressively. So through isometric exercises first, then concentric, and only in later stages, eccentrics. So we need to be able to distinguish between these types of movement and understand their effect on specific tissues. So that means studying anatomy, studying movement. We know that, yeah, for sure, many dynamic exercises, they combine both concentric and eccentric actions. Can you think of something like down to stand? So we know that movement from down to stand is concentric and the reverse is eccentric. And for sure, like skipping foundations altogether. We know that what good is it to train on a peanut if the dog can barely hold a proper square stance on simple balance foam pads? And the surfaces, don't forget the surfaces. We also need to pay attention to the surfaces the dog is training on. Are they ready for unstable equipment like inflatables? So if a dog can't maintain proper form for an exercise, we need to teach it first using a simple setup where they can succeed and then progress once they're ready. In fact, do we even want to use inflatables in this situation? Or are we aiming for example, for strength and power, which are often better developed on stable surfaces? So you have to know what your desired outcome is and then plan accordingly. And speaking of doing harm, please use surfaces that provide good grip under the dog's paws, covering the entire area where the dog moves. So a yoga mat doesn't help if we then toss treats around, making the dog slide after them, or guide them through a cavaletti setup where they walk off the mat. Again, I'm not talking about the average dog owner, although if they're your clients, please kindly remind them. But I must admit that I have seen this overlooked in professional rehab facilities as well. Because remember, the way we present our work to clients and to the public is what sets the standard. So I think my main takeaway here would be that make sure that you are the kind of standard setter that represents the quality that we aim to provide.
Sorry, I have to unmute myself there. That was amazing. That was so clear, Jana. Okay, so communication, asset and enemy. Having that certainty, because confusion means there's a loss of motivation. And then repetition and recognizing that help versus harm, and then understanding progression, and probably most importantly, we need to set the example in our own facilities, which I think is like, that is a big thing for me that I've seen in different spaces. And I think we've all identified that on social media, for example. We've had so many people let us know through, for example, the industry report, that one of the biggest things that they struggle with is watching professionals demonstrate exercises on social media badly or incorrectly, and it makes you want to tear your hair out. And I think that's understanding good exercise progression, form, the goals of specific exercises. I don't think that's something that we actually learn fully enough when we qualify as rehabilitation professionals. So I think there's definitely a gap there. And I love that VAHL has actually introduced a certification program to fill that gap, right? That's awesome. That's awesome. What I would love to know from you, in like clarifying one of the points here, is this area where we're not specific enough with our instructions, creating exercise programs that are clear to our owners, having very specific information like the amount of reps, the length of rest, etc. Creating programs like that are super time intensive. And because you have to do it individually for every single patient, that is even more time intensive, and that can be overwhelming, which often means that as professionals, we don't do it because it's a lot of additional work. So programs like Equicantus or Go Charlie that have those exercise prescriptions with a video demonstration, and then they cue you to add repetitions and instructions, etc. Do you find that is helpful? Do you use a program like that, or do you create exercise programs from scratch? How do you bridge that gap between the amount of work that it takes and then still having clear instructions for your owners?
Yeah, I think these resources are fantastic for someone who maybe don't have other opportunities or resources to create their own. But as I introduced myself, I'm also a course creator, so I love setting things together. It takes me a lot of time, I admit, but I have a wonderful team that is coping up with me. So we kind of work around that really well, because usually when you create something as your own little template, you can reuse it afterwards quite easily. So whatever the resources, be it something that's already available for the professionals to use, or you create something on your own, use it at your advantage as a template, and then basically you don't have to create all the time new stuff. You just like pull the strings together and point owners in different directions. So for example, in our practice, we are handing out, after the entire instruction during the therapy session itself, we hand out the papers. So we decided to use the papers instead of digital form, because we found that people, when they have it in their hand, they're much more compliant. They stick it to the wall, they stick it to the fridge, and they have been returning to us with a feedback that it really helps to have a paper because it's there and it's looking at me and it's a reminder, versus just having something downloaded on the computer and then it's in one folder that you never open. So how we bridge that digital and paper thing is, for example, with QR codes. So on the papers, we have like the instructions of the exercise, we have the image, we have the basic description, we leave the place to fill out how many repetitions, what the equipment to use. To save time for us, we also have on there for example, usually the general stuff that we use, and then we just like circle, or we have the place if we need to make some adjustments. And then it's a QR code that leads the owner to the video demonstration of the exercise that we like videotaped earlier. And I also encourage owners to videotape their own dog, or I videotape them doing the exercise, explaining maybe something else, so they also have it videotaped if I see that they're a bit like not super confident in what they're doing. So I think this really saves a lot of time, but on the other hand, this I see it's really an added value and time that we personally at Dr. Motion like to spend, because people really find the value and are really happy to get this clear guidance that they might be lacking before when they were maybe on their own or something else. So I see that the clients are valuing that extra effort that we put in that.
I like that. And that's not too difficult to set up. So if I think about what I would do if I wanted to set up something like that, I would look at my week, this week's clients, and I would say, these are the exercises that I've prescribed. These are the common ones. So here's 5 exercises that I prescribed more than twice or more than 3 times. And then I would set those up and prep them in that way. And then every week add another 3 to 5 exercises until I have a more comprehensive library, and then have, start incorporating that into the sessions a little bit more easily. So, okay, I like that. Thank you.
Like progressive way, it always has to be.
Yeah, it has to be progressive. And you mentioned the QR code. Does that QR code go to a video of the exercise, so they can just like scan it, watch the video, and then use it or not use it? Can you create those for YouTube videos? Because creating a YouTube channel is free. You can put your videos on unlisted, and then you use that link.
That's exactly what we do.
Okay, yeah, that's very easy. That's available to everyone. Just YouTube channel, unlisted, pop the videos up there, and you're good to go. I love it. YouTube is very handy. Can you okay. That's awesome. Guys, if you've joined us live in the last few minutes, welcome. It's so good to have you. I see we have lots of new people, so I just want to say welcome. Let us know where you're joining us from. Introduce yourself. Say hi. We want to chat with you, so join the conversation. If you have any questions, please feel free to ask them. We are here to chat with you guys. Okay, so let's talk about prescribing and progressing exercise, right? And what, as professionals, like, what are the factors that we should be looking at and considering as we do that? Hi, Rachel. It's so good to have you. Good morning. Okay, so progressing exercises, Jana, what do we want to look at, and where do we want to, what are the factors we want to consider before we progress?
Yeah, I think this is a very straightforward one for me. When it comes to progression, my main indicator is always the dog in front of me. Do they understand the task? No? Teach it. Yes. Can they perform it with proper form over several repetitions? No. Keep working on it. Yes. Excellent. Now it's time to progress. But before anything else, know the diagnosis. If you don't know what you're treating, how can you create a suitable treatment protocol, yet progressions? So if the diagnosis is still unclear, or maybe sometimes it cannot be achieved for whatever reason, then we are in the position that we need to communicate this clearly with the client in front of us. So in that case, let them know that we take things even more slowly, essentially working as if we are treating the worst case scenario. And then carefully observe how the dog responds, adjusting our approach as needed. But ideally, we should encourage clients to reach a diagnosis, or at least to rule out some possible pathologies before we begin treatment. And next, when we have the diagnosis, or we rule out what is not, we have to know the tissue healing times. Once you have the diagnosis, you know what tissues was injured. So the next step is to understand how long that specific tissue needs to heal. And you guys at Online Pet Health have a wonderful resource on tissue healing times. So everyone listening to this talk should head there and review it. because this knowledge gives you the foundation for building a suitable therapeutic timeline and plan your progressions. It's been my go-to resource for sure.
Oh, thank you, Jana.
And third, know the anatomy and know the mechanics of the exercise. We have already mentioned that. Which body parts is the exercise loading and in what way? Isometric, concentric, eccentric, which areas it is pairing. Let's say that you're working with a dog 3 weeks post-pillow. You don't want to load the hind limbs too much yet, but that doesn't mean that you can't challenge the front. For example, front feet side stepping exercise, where the dog is like stepping from one object to the other with the front feet and rear feet are stable in position. So that's an exercise that primarily engage the shoulders, but the hind limbs, they work isometrically. So just to stabilize without requiring any joint movement. And later you can easily progress the exercise. For example, have the dog step between higher objects with the front feet. So their center of gravity shifts over to the hind end. And then once that's mastered, you can place an inflatable under the hind limbs to increase the challenge. To see a single exercise that might first appear to target the shoulders can do much more if you understand its mechanics and plan it well. And you can progress in many ways. Increase the number of sets or repetitions. You can change the cadence. So how quickly the dog performs repetitions in a dynamic exercise. Increase the duration if you're having like static holds. Then progress by modifying the equipment setup. We know that elevations shift the dog's center of gravity, and wherever gravity shifts, the load increases and the strengthening outcome. Adjust the dog's head position or the direction of the dog's focus. Incorporate leg lifts, use inflatables to challenge proprioception. So the possibilities are really endless. But bottom line, I would say you progress once the dog can achieve and maintain good form for the desired number of repetitions. But yes, progression is a tricky thing. If you progress too quickly, you risk no result or worse, injury, re-injury. But on the other hand, progress too slowly and then you risk, again, no result or even a decline in fitness. So I think we have to find this sweet spot for both the dog and the owner, because sometimes the dog may be ready, but the owner isn't. Perhaps they're still learning how to guide the exercise properly. So that's why we need to progress the team in front of us, always according to their individual abilities.
Oh my gosh, guys, if you are loving listening to Jana as much as I am, I don't even know. We've got to keep having you on, Jana. Like, you're so clear and this is so fantastic. So I just want to say hi to everyone. Rachel from the UK, thank you for joining us. Emily from Sweden, so good to have you. Nicole from Australia. What time is it in Australia? I always have to ask that because it's always a terrible hour. And Debbie from New Zealand. So it can't be that much of a terrible hour right now. It's so good to have you. Rochelle, also from New Zealand. Guys, welcome. It's amazing to have you. If you guys have any questions, please share them. We are really here to have a conversation with you. So let's get into it. And Alex from the UK, good morning. Jana, when you started answering this question, you said, number one, the dog needs to understand the exercise. And then number two, they should have proper form, right? And understanding comes before proper form because they can't have proper form if they don't know what they're doing. So I want to go a little bit into each of those a little bit more because I often think that we skip over understanding because most of us are not trainers. So we don't necessarily train a behavior or train a skill or an activity. We use a lot of luring and we might skip over that understanding. So can you explain to us why we do need to actually teach a dog to understand the goal of an exercise or to understand how to perform an exercise? What are the flags that we should be looking out for so that we know that understanding is not in place yet? Can you go into that a little bit more?
Sure. I think I will first touch upon the luring that you have mentioned, because oftentimes this seems like an outdated method, but to be honest, in fitness, probably that's something that I prefer to use the most. So although I love clicker training and shaping my dogs for all sorts of behaviors, really, you name it, in fitness, I simply go back to luring time by time, and not just with my own dogs, especially with my clients, because they come with different pre-knowledge. And luring is just like the most straightforward approach that you can take to achieve a proper form as soon as possible, so that you cannot spend a month on teaching an exercise if you have like an example of a typical dog in front of you where you actually need to progress through the weeks. Because what's the point if you're doing one exercise to just teach the understanding over the next 2 months, you see? So there is a fine line between teaching, understanding, and how you can influence as a therapist, as someone who also guides the owner. You can influence the performance a lot. So oftentimes the dog doesn't even have to have any pre-knowledge, but you can guide them really well. So here I would definitely say that educating further in the teaching methods in how to guide a dog is really important for us as professionals, because in the first line, we have to be sure what we are doing, because only then we can teach others, and we have to teach the owners. So we have to have that knowledge. And then, Anne, you mentioned also some of the red flags for the posture. And maybe, should the correct form always be prioritized during an exercise? I would definitely say a lot. I don't think I can stress enough how important like proper form and posture are in fitness work. And again, I would like to relate that I sometimes feel disheartened when I see photos and videos circulating on social media where form and posture are overlooked. We mentioned that in the beginning. And again, I'm not talking about random people posting from home. I mean professional facilities and rehabbers. You see compensatory movements, red flags, roach backs, poor weight distribution, even poor reward placement, which shifts the dog's posture like entirely. Sometimes even changing the entire exercise benefits or purpose. I'm sure that we will be talking a lot about this at this year's Vet Rehab Summit, won't we, Anne?
Yes, we will. Yes, yeah.
So think about how a dog should be standing, should be moving for a particular exercise or case. So you have to learn that. You have to learn that from somewhere. And if dogs can't reach that posture, then just replace the exercise with one that the dog can perform successfully. So for example, use less challenging equipment. Adjust the way you guide the dog. But please don't push a dog through a setup that doesn't offer the intended benefit, or where they don't feel secure enough to perform with confidence. So when it comes to correct posture, if you're talking about square stand on a level surface, we can definitely point out some of these, like what we say, key indicators. For example, straight forelimbs positioned firmly under the chest, a straight back, hocks perpendicular to the ground, feet parallel, head in a neutral position, focus straight ahead. So there are a lot of rules. For sitting, this might mean like flex knees, hocks, hips, with the feet like close to the body, and so on. So therefore, some of these red flags to look out for could certainly be any deviations from the expected form. Compensations like a roached back, excessive paw movement during stationary exercises, shifting weight off one side or like leaning over, also attempting to sit or lie down, even calming signals such as looking away, disengaging, sniffing. So all of this may indicate that the exercise, in fact, is too challenging for the dog in front of us. So yes, correct form should always be prioritized. However, you also have to take into account the dog's current state, structure, and abilities. For instance, take a dog recovering from FHO, for example. So they might not yet be relaxed through the lower back, standing rather like tucked under, hind feet position beneath the pelvis, roaching the back, maybe also hyperextending the hocks. So this dog is not going to achieve a square stand just by being placed on platforms. And it's also not fair to push for that right away. So again, I think I'm coming back to that. See the dog in front of you, work with the dog in front of you. So in those cases, I make a compromise and start with what the dog is able to offer. And then slowly and gradually, I help improve it. So in this case, maybe I will begin with like 2 large stable objects that the dog feels comfortable just standing on. And then maybe in next week, I will be able to space them slightly further apart to gently open up the hind end, help relaxing the back. Or maybe that will take like 3 weeks, who knows? So what else also could I do to help them there? In addition to that, for example, work on slalom walking, figure eights to encourage like more flexibility through the lower back. I might use slight elevation under the front feet to support hip extension. For example, then senior dogs, we were all working with senior dogs. So imagine a senior dog in front of you who simply can't stand with completely parallel feet. So should I abandon the cookie shifts exercise where the dog shifts weight left and right while standing, where we know, okay, we need to have a square stance, we need to have feet parallel. Should I like just abandon it? Like, absolutely not. I will let the dog begin in whatever posture they're currently able to manage and then work from there. So maybe I will start with, again, wide, low platforms that allow an offset posture. And then in the next week or two, I will go a little narrower, then again narrower. So eventually the dog might feel confident and strong enough standing on narrow platforms that actually encourage parallel feet. And along the way, I will also work on exercise that promotes symmetry, like cavaletti rails, slalom walking. So the sky is really the limit, but only if it's suitable for the dog in front of you. And if the dog still isn't able to perform one particular exercise well, despite all setup adjustments, just move on to another one that they can do. And often I find that a well-rounded variety of exercises done consistently, they come together like puzzle pieces, you know. And later when you revisit a challenging exercise, you might find that the dog can actually like suddenly do it better. And I think that's really a moment worth celebrating. So yes, as much as I advocate for optimal form and performance, it's equally important to recognize the dog's current limitations and to adjust the exercise in a way that ensures both safety and effectiveness.
I love that. Thank you. Rachel says, I'm really enjoying this. The clarity is really helpful, and finding a way for clients to be able to achieve the exercises is so important. Thank you, Rachel. Luring is easy for the clients to achieve at home as well. Just adding in a cue once they have an understanding and removing the lure relatively quickly.
Yep.
Marketa's from Dubai. It's so good to have you. Marketa, I know you. That's super cool. And then having Alex is having warm fuzzy feelings as this is music to my ears. Yay. I agree. Thank you, Jana. You are so clear. I love that. Okay.
Thank you.
I think, do you know, I think on the subject of like what's circulating on social media, I think it's worth celebrating that I have been seeing more and more really good exercise videos coming out. And I actually think that is partly to be attributed to the CCFT program that VAHL has been running, because I have noticed that some of the people that are posting are students and they're like sharing their journey, and then, you know, it's actually really cool. So Jana, will you tell us a little bit about the CCFT program, what it is, who is it for, and how can people jump on board? Jump on board.
Yeah, so I think like I said in the beginning, we are standard setters. So the more we know, the more we share these like good practices, the more I think we influence others. And even if someone just simply doesn't have the knowledge, or maybe they don't even realize that something exists or should be done in what way, because they didn't receive maybe this training in their earlier time. I think this is really important, and sharing this among the group of like-minded people, it's always good, because I think it creates like this snowball effect, you know. Someone sees somewhere there and they're like, oh, this looks interesting, let me dig into that. And then once you start digging in, the more you see that you don't know you know how it goes, and then you start to dig, and you're way too deep sometimes. But I think education is what is really needed out there, and I believe that all training programs out there that are focusing on giving you the clarity, giving you the resources for good practice are important. So whoever is thinking about expanding their knowledge, getting certifications, like for example through VAHL, Certified Canine Fitness Trainer program that has been revamped, and we're working on it, just to give you the resource where you can learn as a professional on how to do your practice better. And in this term, exactly the fitness exercises. So for example, we are talking about the mechanisms of actions, which areas, which muscles are they targeting, in what way, how to progress with them, how to set up the equipment. We talk a lot about how to teach it, how to achieve the form. So basically everything that we have been talking today, it's a part of that. So yes, absolutely, I invite everyone who is who wants to expand that knowledge to join. The best way to join is definitely heading through a VAHL website. So that's Veterinary Academy of Higher Learning, and you can just simply learn more about the programs there and where they are held, because you also have presence days with the instructors. So it's not just like online learning, but we have hand-on labs as well. So yes, definitely worth exploring.
Okay. I've just posted the link for you guys to that VAHL program. So if you want to check it out and learn more about it, please do go there. As you were, one of the things that you said is, so you highlighted that luring is actually a super great tool that we have that we should use. It speeds things up. It's fantastic. So that's great. But one of the challenges that we have with that is correct reward placement and our own handler biomechanics and body position, etc. And that, I mean, that is one of the things that was a huge eye-opener for me when I started doing a program with horses, where I really had to focus on myself. It was really a program of teaching me instead of teaching my horse. And once I realized the enormous impact that my own position, my own skill level had, I started seeing that in canines as well. And it's a big thing. Our own body posture, our reward placement is massive. So that's one of the things we're talking about this year at the summit, because I think that as professionals, it's an area where we're very much lacking. And I love that the conversations are coming out around that. So yay. Do you want to say anything about the lure placement or the reward placement?
Yeah, we have to absolutely know that the focus of the dog's head, so where they're looking at, absolutely influences the way the dog's weight is distributed. So if you're looking at the dog, maybe imagine a dog standing square. If they're facing straight ahead, we know by the research that approximately 60% of the dog's body weight is carried by the front and 40 on the hind. Yes, there are differences between the breeds, but let's say it's a general rule of thumb. Now, if you imagine that the dog looks up to their handler, and if you have a small dog, for instance, and they're looking really high up, you think that the weight distribution will still be the same? Definitely not, believe me. So if the dog is looking up and the head goes up, I mean, everyone who is listening, you can just like stand up and try to look up. Just do that. Or maybe you can lean in the chair. So where does your weight go? Where does your center of gravity shift?
Backwards.
To the back? Yes,
yeah,
to the back.
my whole spinal mechanics is different. Like I'm arching my back.
Exactly. And we can influence this. For example, I mentioned cookie shift exercise. So that's an exercise we call where the dog is standing and we are moving the head to look in different directions. So up, we can do down. Down focuses more of the shift the center of gravity more to the front. Sideways, you have this difference among the left and sides. But as soon as we can influence something on purpose, excellent. If we do it not on purpose, then it might change the behavior. It might change the exercise outcome. So we have to be aware of that, because it can make a significant difference on what we are working on. Just give me another example. I love examples. I think it helps to clarify things. We are talking about standing dog. Now imagine a dog that has their hind feet elevated. Yeah, you have the dog in front of you, hind feet elevated on the platform, front feet on the ground. Now, just by the science of it, we should say, okay, the majority of weight should be placed more towards the front end, right? It should be, because the height is elevated. The front should work way more. I mean, position yourself in that position, and for sure your hands will hurt much more. You will feel them much more. Now, if we are thinking about using this exercise for front end strengthening, perfect. But what if we reward the dog from above? Do we still have that front end strengthening? Not nearly as much as if you lower yourself down, be at the level of the dog, where they can actually keep their focus down towards the ground, keep a neutral spine. So that's like one really practical example how you can influence the weight distribution, and then either you have the outcome, the effect that you're seeking for, or you don't have it. So I absolutely put a lot of attention on our own body mechanics. And yes, once you master it, it's super simple to take kind of like any inexperienced dog and just do the exercise really well, nearly from the beginning. But then it's a tricky point. You have to teach this to the owners. So I think a major thing that I met during my practice is, once you know a lot and you know a lot of mechanics, you know a lot of behaviors, you just have to know that the client in front of you might not have that knowledge. I mean, we have some sporting dog owners, dog trainers that have a wide variety of pre-knowledge, and they're really absolutely amazing clients to work with, because you can progress, you can really get this sparkle in there. But the majority of clients, that they are inexperienced. So I think I'm going back to the foundations, back to basic all the time. And that's not bad. The basics, the foundations are, I would say, the bottom line of the pyramid that holds everything up. So no matter the progressions and the fancy stuff that we see out there, just again, think about the dog, the team in front of you, what they are able to do, and just build from there little blocks and then celebrate the victories.
I think that's so important, because it is that was another challenge that I ran into, right? Like, as my skill improved and increased, I got really excited about what I could do for my patients, but that knowledge didn't transfer naturally to my clients, and they couldn't do the same things that I could do. So how to bridge that gap? Where do we go from there? Like, that's something that I'm still figuring out for myself. But for sure, having a really good, if we understand the foundations and we have learned them and relearned them, then we can teach them also. If we haven't done that and our foundation knowledge is a bit sketchy and is kind of
theoretical,
or just theoretical, or just based on like what comes naturally to us, we can't teach that. And then that's a bit of a gap. So I think from your guys' comments, you're all with me. This topic of like having really effective exercise movement strategies is it is at the very core of what we're doing as rehabilitation therapists, right? Yes, our hands are our greatest tools. We are working with the physical body. We are finding ways through manual therapy and electrotherapies to treat pain and dysfunction. But if we cannot return our patients to functional movement, we are not even halfway there. So returning to functional movement and retraining movement is right at the foundation. And that's why I'm so excited about this year's summit subject or summit topic or theme, because that is what we're talking about, right? We're going into dynamic by design. Our patients are made to move. How are we going to level ourselves up to make sure that we're filling all those gaps that we've identified over the years, and providing them with the best possible movement rehabilitation that we can? So Jana is one of our lecturers this year, obviously, because she's fantastic. So Jana, can you tell us what you're talking about at the Vet Rehab Summit, and why you're excited about it? Because it's going to be
Yes, I love the topics of this year. I think this has been like the first Vet Rehab Summit that will speak so much about these physical exercises, and they're truly my passion. And I think this all speaker team is going to be fantastic, and we will fit into each other perfectly. My contribution will be, I will touch upon canine athletes and this functional rehabilitation part. So kind of how to progress with a sporting dog, with a working dog, beyond just this basic therapeutic plan that we usually have quite a good knowledge on, but we know that athletes, they need a step further, and how to support them through that stage as well. So I will basically connect everything back to the tissue healing times, to the mechanisms of action, to how to connect them to actual movements, because that's what it creates a suitable progressive plan for an athlete, for example. And I think it's been an ongoing debate about stable and unstable equipment. I think we hear this a lot. In the past, maybe I've seen primarily doing work on inflatables. It was kind of like a how to say, like a stamp for rehab, for fitness. The peanuts, the inflatables, the discs, everything. The more colorful, the better it was. And then over the years, I think when we started to go back to the foundations and to taking more care and more attention to how the exercises are performed, the more we see that inflatables are not necessarily used for all the aspects. Yes, they have their role in rehabilitation, they have their role in progression, but we have to also understand the mechanism of working out on stable surfaces, on working out on inflatables, because it has different outcomes. And you should know both so that you can actually get the best benefits from both and incorporate, for sure, both in your practice. So yeah, I'm looking forward to it.
I'm so excited. So guys, when I set up, like when we were planning the program, I had Jana speaking about first stable versus unstable surfaces, and then that return to sports progression. And Jana was like, no, but that doesn't make sense. We need to turn them around the other way, right? First the return to sport, then the stable versus unstable. And I was like, but I don't understand. That doesn't make sense. First, we use the unstable surfaces, and then we progress to sports. And Jana was like, no. And then the more I thought about it, the more I was like, oh my gosh, what am I doing? Unstable surfaces are a higher level of progression. And because I don't work with dogs in clinical practice, so it's not something I'm thinking about and doing all the time. But that was kind of my initial training, right? Like the post-op dog comes in and, hey, we have a little foot paw or some disc or something, and we're doing little perturbations, and it's like, no, actually that's a progression that we need to work up to. So I love that. I love that she pointed that out to me, and I learned something just in the program this year.
Thanks for listening to me and for turning the schedule around just based on my wishes.
You're the expert. We're gonna go with your wishes. Guys, so right now, early bird tickets are available for the summit. We have opened early bird sales. It's really gonna be so good. Go check out the program, see who all our speakers are, because we have, in my opinion, the best speakers on the subject. And we have this year decided that you will be able to register for free for the entire live event. You don't have to buy a ticket. You can just come to the whole event. If you come live, it is free. So you literally have nothing to lose. Just go register for a free ticket and join us live. The caveat is, of course, that if you register for free, you cannot get a CPD certificate because we can't create those pathways for you, and you don't have access to the recordings. So there you go, but it's still worth joining us live for the entire event. I'm going to post the link for you to the Vet Rehab Summit website right there. And we have some comments. So Alex says, let me pop it up on the screen. Enthusiasm is definitely contagious. I tell my clients when their dog does something amazing or has a penny dropping moment that I get goosebumps. They might be concentrating on the task while I'm checking form and function. I get more excited than they do sometimes. Alex, I love that.
Yeah. I absolutely agree. I mean, also in my practice, my experience, the more we share these little victories with the client in front of us, and they're not aware of them, not all the time. And when we point them, they become more aware, they become more observant, and they're like, yeah, right. And through time, it has come like back to us so many times that they were like, after a few visits, after a few months, sometimes I became so much more observant of my dog. It's fantastic because they learn it from that little victories that we pointed out. And yes, absolutely, I agree that enthusiasm is contagious for sure.
Rachel says, I'm so excited for the event. And Alex has already signed up. So, yes, good job, guys. Jana, I do want to ask just one more question of you. Where can people learn more from you if they're not wanting to wait for the summit? Because you do have some really awesome courses available on your website. So tell us about them, which ones would be relevant to us as professionals, and where can we learn more from you?
So if you would like to learn more or stay connected, you can definitely follow me or Docs for Motion on social media. We really do our best to regularly share tips, case studies, sometimes also behind the scene at what we do in both our rehab facility and online. So we are on Facebook, we are on Instagram. And then you can also join us through one of our online courses. So like I said, through Docs for Motion Academy learning platform, we offer a variety of programs focused on conditioning, sport-specific training, even general behavior work. So even though that these are designed with dog owners in mind, we have had many professionals go through them and find great value in applying what they have learned to improve the way that they approach fitness and rehab work in their own practices, especially when we were talking about how to teach certain things. So this can certainly be resources that are beyond just the fitness as such, but kind of understanding the way the dogs learn. And I think that's also an interesting topic, maybe for someone who is not so experienced in that. And if I just like talk a little bit about the fitness work that we do, for instance, we released a psoas power course earlier this year. So that's a course specifically dedicated to strengthen the iliopsoas muscle. We know that's an area that's frequently injured, especially in active dogs. And not just active dogs, also many times comes as a compensation due to other underlying physical weaknesses. And that's a course where I have poured nearly all of my knowledge and experience into it, based on the success that I have had in reconditioning this area and even returning dogs to competition start lines if we're talking about athletes. So if you have a client dealing with psoas issues, this is definitely a resource worth exploring. As for fitness exercise in general, we have talked about certifications. No matter what certification program you have gone through, whether it's CCRP, CCRT, maybe something else, we all receive like varying amounts of training in therapeutic exercise. But when it comes to fitness work in general, I think the sky is truly the limit. And there's always something more to think about, improve on, learn from. And like I said earlier today, what better place to do that than in a group of passionate, like-minded professionals who genuinely want to keep growing. So if that's you, if you want to deepen your understanding of canine fitness and connect with others who share the passion, so the VAHL Certified Canine Fitness Trainer is definitely worth exploring. And it's not just about getting more tools for your toolbox. I think it's about building that confidence, expanding our creativity, and also continuing to push the standards of what we can offer our patients and clients. And yeah, you might even find me as one of the instructors at some of the events.
Awesome. Jana, thank you so much. Guys, I think we have taken full advantage of Jana's time today. I do see there are some questions, but I think we'll come back to them in the comments afterwards so that we don't end up running over an hour. Jana, thank you so much for your time today. It's been really great to have you.
It's been a pleasure. Thanks for the invitation. See you at the Vet Rehab Summit, all of you. And wow, enjoy your time till then and keep growing.
Awesome. Bye, guys.
Bye.